All right, everyone. We'll go ahead and get started. My name is Angela O'Lallery. I am the current sitting president of Guilford Gifted. Thank you all for being members. We appreciate you. And we've had a lot of parents reach out and let us know that they'd like to learn more about socio-emotional issues with our children. So hopefully tonight will be a step towards making that or giving you some information about that. I, for one, am really excited, and I would like to introduce Ali Caputo. Am I saying it?
Cupito, yes.
I'm so sorry, Ali.
Right.
She's a pediatric psychology expert. She works for Cone Health, and she's in the integrated behavioral health with the Pediatric Teaching Program. Her professional interests include intersection of physical, behavioral, and emotional health, and of course, health promotion and prevention. So join me in thanking Ali for coming tonight, and we are ready to watch and learn. One thing to know is I have turned off the chat, but we do have the question and answer function up and running. So if anybody has any questions, please feel free to drop them in there. And when Allie's all done with her talk tonight, we're going to take some question and answer time if there's any good questions out there. If there's anything pressing or too personal, I will send it to Allie on our own time and I'll personally get you an answer. So feel free to use that function and let's get started.
Hello, everyone. Thank you so much for having me. I'm really excited to be here. And this is a topic near and dear to my heart. I actually became more interested in perfectionism in gifted youth, unsurprisingly related to my son. He's in the third grade at Pilot, and we'll go to Lincoln next year. And a shout out to Miss Koopman, his AIG teacher. I was talking to her about some things, and she actually sent me a presentation she had been to on this topic with perfectionism in this population, and it got me interested in reading more about it. And then professionally, I am a pediatric psychologist, and I actually teach gifted learners at a different stage in their life because I teach medical students and medical residents. And what's really exciting in the pediatric world is next year we're actually all residency programs are required to have a mental health curriculum. And this is actually coming out of the youth mental health crisis that we know there's a huge shortage of psychologists, psychiatrists, and more mental health is being treated in primary care, but our primary care workforce isn't necessarily trained and ready. And so that's a big part of my role is getting our workforce ready for that. And then I also do supervise some clinical psychology students, doctoral students. I do see patients on our medical floor. So again, I do a lot of like chronic health, working with kids with chronic health difficulties. And then I do a lot of like making community partnerships that will both help our residency program and help our patients. So that's a little bit about what I do for both personally and professionally. And so let's start by talking a little bit about giftedness in mental health. I've actually been like on social media and media in general, seeing a lot of memes about like how terrible mental health is for gifted students. And I think there's a lot of myths, especially in terms of putting gifted children in specialized programs. And I know just my own experience with my own kids, I have actually had more frustrations when they haven't been in adapted curriculum. And my son, his favorite part of the day is his AAG class, and he feels really challenged. And, you know, kindergarten, first grade were really hard when they weren't quite differentiating much. Um, so it's been really interesting because as I've looked more into the research on this, it's actually pretty mixed with well-being. And a lot of where it's mixed is when we appropriately accommodate gifted children, they do better social emotionally. So the whole kind of, well, I don't want to put my kid in a gifted program, even though they qualified because it might be too stressful. That's actually kind of the wrong way to think about this. Because if they're not in a program where they're learning kind of like at the right level, that can actually be detrimental in lots of ways, which we'll talk about. And then the other thing is I want to point out that gifted children have a lot of social emotional strengths. And what's hard is and I do psychological assessment too, a lot of when we look at gifted children, they show more variability because they have more extreme strengths. And so, for instance, most kids, like if we look at IQ, we don't see a bunch of variability in like processing speed or working memory. Those are pretty constant. But when we look more kind of at like perceptual reasoning or verbal comprehension, those are where our gifted kids kind of seem to kind of be off the charts in a lot of ways. And then emotional development can only happen so quickly. So it's hard when your child like cognitively is a much older, more mature age, able to understand, especially with everything going on in the world right now, able to understand what's happening, but not quite have that emotional coping quite yet. That being said, with the social emotional strengths, they're going to learn coping skills quicker, first of all, and we see like higher levels of like their academic self-esteem basically, and higher levels of life satisfaction. And then when we look at giftedness and anxiety, again, this plot here is like a meta-analysis looking at whether it's negatively correlated or positively correlated. And as you can see, it's all over the place. And so some studies, depending on like what kind of anxiety they look at, find all different kinds of things. And so like, and I'm just pulling from very specific studies. There's some studies that say gifted girls experiences higher level of anxiety, where boys, there's no difference. But then a recent meta-analysis actually showed that gifted children show fewer anxiety symptoms than the general population. And that performance and trait anxiety is less common. However, so trait is like, is it part of your personality or kind of who you are feeling anxious? And state is like, do you feel anxious in certain settings? So actually show less trait anxiety. And now let's talk, and we'll talk about the overlap in anxiety and perfectionism in a moment. But now let's talk a little bit about giftedness and perfectionism. Again, it's a myth that, especially when we look at maladaptive forms of perfectionism, gifted children actually, research show no difference in perfectionism. But when we look at specific domains, I think part of where the myth comes from is that I think people assume these kids are going to succeed, and that can sometimes feel like the assumption that they have to be perfect, which are very different things. And there's like, we'll get into this too, but adaptive versus maladaptive. So some gifted students will show more adaptive, which again is like goal-oriented, organized, believing in yourself kind of things. And they often compare themselves like appropriately to other kids older than them, but are kind of the same mental age. So they tend to not compare themselves to their same age peers that are not kind of in gifted programs. But they also tend to be more sensitive to expectations. And sometimes, and this kind of just goes along with giftedness in general, like there's an overexcitability, both emotionally and in terms of like academic interest. And I know I've totally seen this with my son, as sometimes he'll like quiz Alexa on all this information, which I think is hilarious. Things like I have no idea about. And then clinically, and with the medical residents and medical students, I see a lot of like overthinking to the point where it feels like emotional avoidance. Like I think if sometimes people who are really smart and think fast and think complexly about the world have figured out a way to not experience the emotions in their body, and that could be maladaptive. But again, like I said before, where we see the most problems is actually when kids are not feeling challenged. And in those early school years, sometimes is actually when we'll see more social emotional problems before kind of the pull-out programs happen. And then if you get kids in an adapted program, they tend to thrive in a lot of cases. I know that clinically and just anecdotally that there are certain kids that do really struggle in those programs, and we can talk more about that too. And so let's just as much as we're talking about anxiety in our world, and it's not always agreed on how we define anxiety. And so just going to define it as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. And then we can kind of break it down by domain. And I'm going to kind of fly through some of this stuff. And so we can kind of focus on the coping skills of kind of what do we do about this. And so basically the big point here is that anxiety actually can be really adaptive in some settings, especially settings where there is danger, or sometimes anxiety can motivate people to work harder. We actually used to think, this is really outdated, you can see 1908, but a lot of people still think this, that like there's an optimal. So the problem is when we look at anxiety, a lot of what we're talking about is actually just like physiological arousal. And so people have this like outdated theory that people still believe is that a little bit of anxiety is good because it increases your focus, but too much anxiety is bad. And that is like has been debunked a million times. So what we actually know is that it's much more complicated than that. And as a child reads and they learn, they use like lots of different parts of their brain. And again, thinking about arousal, it's more about, rather than like finding the optimal level of anxiety, it's about these positive learning states. So as kids and adults learn, we want them to be intellectually aroused or interested, but calm, basically. And that's how we know that that's kind of what study shows will then increase memory and learning. And so the more we can decrease the feeling of threat and more we can increase the feelings of anxiety, the better that a child both will learn and be socially and emotionally, if that makes sense. So really it's these negative emotional states that can be maladaptive. And so basically if you sense a threat, your brain becomes really not open to information. And again, like as an educator, I see this a lot with residents. So I round the team in the hospital, and the beginning of the year, July is when they rotate through. And so we have like the brand new residents and they're all terrified and they feel like rounds, we try to make it super supportive and open, but they always feel like it's super evaluative. And so as they're presenting on rounds, you can kind of see them like get emotionally overwhelmed, and like learning is not going to happen. Like it's impossible to give a resident feedback in a way that's received when they're in that negative emotional state. So again, there's different things we do with peds. So we start with the joke. We do really like, sometimes we'll talk about our favorite color. So we'll do things to like increase team bonding and increase comfort because we know that that's going to improve learning. And it's the same thing in the classroom with your children. Okay. So part of the problem with anxiety, so again, everyone feels anxious, and some kids and people will go on to develop anxiety disorders. With the youth mental health crisis, we're seeing more and more anxiety disorders. And when we look at the trajectory of kids over time, anxiety tends to develop a lot earlier than other mental health disorders and tends to be a risk factor for other mental health disorders. And unfortunately, we actually over normalize anxiety and don't even typically screen or consider it a disorder. And again, this can lead to lots of problems in adulthood. And this is somewhat new, 4 or 5 years now ago now. The American Academy of Pediatrics actually recommends that ages 8 and up across the board at all pediatrician checkups be screened for anxiety. If your pediatricians are not doing that, you can request that. And here's some screenings. So it's something that they should be doing. And just kind of briefly overview of anxiety disorders. And so let's get into a little bit about perfectionism, and then we'll get into the overlap and what to do kind of both about perfectionism and anxiety specifically for our gifted kids. So perfectionism, even more so than anxiety, as a field, we have not agreed on a definition. but I'll talk about a couple of different theories on perfectionism. One is looking at the different compartments. So self-oriented is more like having high, unreachable personal standards of achievement. And this is actually correlated with depression, anxiety, and actually hypomania. Other oriented perfectionism is when people have high expectations of others. And socially prescribed is when there's a perceived pressure from the social environment. And this is also associated with like negative mental health outcomes and sometimes actually aggressive behavior, because people will get so focused on things being perfect. And then if something doesn't go that way, then they're likely to have an outburst. And again, thinking about arousal, anxiety and anger are like really interconnected. And I mean, at any age, but when we look at younger ages, I find that kids are like not as able to control that. So a lot of times, just again, like working with patients, I will see kids coming in with these like extreme tantrums, going to school, kicking teachers, and parents are like, I'm really confused. My kid never acts like this. And it's actually underlying a lot of separation anxiety or some kind of anxiety that's leading to this outburst. And so, like I kind of alluded to before, there's this idea that there's healthy perfectionism, which is really like setting challenges, setting high goals and standards. This is the kind of, I feel like a lot of people are like, oh, I'm a perfectionist. And it's kind of like a way they brag, like, oh, I do great at everything because I work really hard. But there's a downside to perfectionism. And this is more when the maladaptive perfectionist is people who like kind of set such unrealistic goals, even though they're succeeding, that goalpost keeps moving. And again, with residents, they're top of the class, high school, college, get into med school, work really hard, get good grades in med school. And then it's really impossible in medicine. You can do everything right and there still be negative outcomes, and especially when you're a learner. And so I do a lot of emotional supporting our residents in like debriefs after a poor outcome or after a tough situation. And there's a lot of guilt and blame and shame that happens. And I think some of it's natural that we're working in really high risk environments, but then I also think some of it is they've been in situations where they're used to winning more or less and used to being really good at things. And in medicine and in life, there's failure that's going to happen. So it's really that like fear of failure that can be maladaptive and hold people back, both emotionally and academically. And so the healthy perfectionist would kind of have more of that growth mindset and learn from that failure, not be scared to fail, understand that failing is learning. But that maladaptive perfectionist becomes really obsessed with goals, increases efforts, avoids activity altogether. And I think there's lots of ways that we see this play out, and I'm sure you all are thinking about coworkers and whatnot, and different people you've seen both be healthy perfectionists and maladaptive perfectionists, and I think we all can be both at different points in our lives, and especially depending on how we're coping in other ways. So I'm oversimplifying, but in a nutshell, healthy perfectionism tends to not be associated with negative outcomes. However, this maladaptive perfectionism is really negative, including I found this article that it's a very strong predictor of suicidal ideation. And part of what happens, and unfortunately on the medical unit, I will see families or I will see youth that are being medically stabilized after suicide attempts pretty frequently. And what happens is there's such a strong maladaptive perfectionism where people get more concerned about their like self-image, especially for that socially prescribed, than how they're truly doing. And so they'll be scared to disclose to anybody that they're having suicidal thoughts, which is kind of the worst thing you can do. in terms of suicide prevention. It's really important to talk about it and hide behind like a socially acceptable facade, see the world as judgmental, and really not want to disappoint. And so people with these maladaptive, perfectionistic standards, when they experience a social stressor, which we know social stressors are also a huge risk factor for suicide, they're unfortunately much at higher risk. So not to be too negative. It's just I want to be realistic in how important this is for mental health. And I have some resources at the end if that's something that anyone in your family is struggling with, that you can connect with. And so again, I'm going to present a couple different models of perfectionism. So this is just a little bit of a different model of this model is just looking at different dimensions. And one of the things I wanted to point out is that it's the child's perception of parental criticism expectations versus the actual parent expectations. And again, I hear this all the time with teens. Teens will be like, my mom will be really mad if I don't make straight A's. And then I'll talk to the parent, and the parent's like, I don't care. I've been telling them to go to bed and not worry about their grades. They always get straight A's. They think, so it's not always based in anything the parent has done. It's more of that perception. This study was really interesting. And I have it linked at the end and can send out my slides. The title of the study is actually, I Need to Be Perfect or Else the World's Going to End. And it's a qualitative analysis of teens' perfectionist expressions. And unfortunately, what we know is over the past 30 years, perfectionism has increased exponentially. And I do wonder how much of this plays into the youth mental health crisis. We do know in terms of, and I wish I had a slide to show this. I have it in a different presentation. We do know in terms of the youth mental health crisis, it actually got worse around 2008, which is also when social media became popular. And we've seen steadily increases in rates of mental health difficulties in teens since that time. And then we saw a huge uptick, actually more in like 2021. In almost 2020, I feel like people were just like confused on what's happening. But once COVID kind of stuck around and really disrupted teens' lives, that's when it really got worse. And I think a lot of mental health professionals are female. And with the childcare crisis, we also saw a lot of mental health professionals leave the workforce. And so we had this kind of like perfect storm of teens not coping well, poor access to mental health care. It's getting better, I will say. The wait lists are nowhere near as bad as they were 2 years ago. And I do think there's been some state funding that has helped some. So this basically was just like a qualitative study and pulled apart different themes that were in these teens' interviews. And you can kind of just see here that it's obviously a need to be perfect, insecurity, needing a lot of validation, and again, I even see that in some of the residents I work with, and a reactivity, and there's a lot of like cognitive features of perfectionism. And when we look at the cognitive features, that's the piece that I feel like overlaps the most with anxiety, is that kind of self-critical worry thoughts, procrastination, fear of mistakes, being kind of overly cautious to the point where, again, failure is good to some degree, risk are good for growth and development. And this is where anxiety and perfectionism can kind of stunt children's growth in different ways, where it was actually harder to come up with things that were different than the same with this. But kind of those more body symptoms of anxiety aren't necessarily considered perfectionism. And then more of the like unrealistic standards aren't necessarily anxiety, although again, these can kind of play in each other. I'm gonna sip of water. All right. So there's actually a little bit of a paradox when we look at gifted students and perfectionism anxiety, in that, so this study, for instance, kind of predicted that gifted children would have both higher perfectionism and anxiety. And again, I think that's like the pervasive myth, when actually for this study, it showed that self-oriented perfectionism actually kind of showed more of the adaptive form of it was higher, but similar levels of anxiety. And so it just kind of goes to show, again, this is really nuanced. And at the end of the day, it just kind of depends on the kid. And at the end of the day, rates are similar. And it depends on the kids, and it depends on the environment. And again, another thing that's gotten a lot of publicity is some of, Ivy League colleges having a culture of, I've heard it's really just perfectionism, but effortless perfection. That's one of the things that has been a little bit in the media. And so there can definitely be a culture that supports this. I will say, I think this generation is doing a good job of pushing back against that to some degree. And so how do we push back? And a lot of what we do really is teaching kids and teens coping skills. And we know that those who've been experienced stress, especially toxic stress, the way that we prevent mental health problems is by kind of bolstering coping skills. I wish we could prevent kids from really, really negative experiences in their life. I think we can do the best we can, but they are going to experience stress. And then when we look specifically at kind of teaching coping skills to gifted kids, I did find some research that this helps both with mental health, which we know, and also perfectionism. So there was a study that did like a 6 weeks mindfulness intervention with gifted youth, and that actually reduced maladaptive perfectionism. So this is the good news, is that I think if we intervene in the right way, we can prevent some of the harmful side effects of perfectionism and anxiety. Also going to breeze through some of this just so that I could go on forever. This is like the bulk of what I teach my psychology students and my residents and medical students about. So basically, my approach to psychology is very behavioral, and there's different waves of behavioral therapy. First wave was more kind of, Pavlov, classical conditioning, and also based on like operant learning conditions. A lot of like for depression, the treatment was behavioral activation or getting out and doing more fun activities primarily. The second wave, which came about, I think like in the 70s, was more cognitive behavioral therapy, challenging negative thoughts, trying to change our thoughts, modify behaviors. As I'm talking, I'm acting like this research is really outdated. Behavioral therapy and cognitive behavioral therapy are very well supported. They're very good interventions. We've just kind of adapted over the years. And so the third wave, which I think is really important for our abstract thinkers, is more focusing on accepting thoughts and feelings rather than trying to control them. And I have trouble sometimes with kids before they're at that stage where they are thinking abstractly, understanding the third wave, acceptance and commitment therapy, dialectical behavioral therapy, and some like value-based therapies. But again, gifted kids are going to be thinking abstractly at a younger age. So like normally I won't do third wave until like 10 or 11, but sometimes I'll get a really bright kid and I'm able to like have them think more flexibly. So it's mainly more about acceptance and cognitive flexibility, whereas CBT is really focused on changing thoughts. And again, sometimes people who tend to overthink tend to what we call intellectualize, get stuck in CBT, because it's like a cycle of like, well, I can challenge that thought, and now I can challenge that thought, and I can challenge that thought back, and then they get really stuck. And so ACT is like, instead of like challenging the thought, it's literally like metaphors where you imagine the thought on the stream and it flows through your mind. And so that has, I think for this population can be particularly effective, and mindfulness is a big component of that. So that's kind of more of the focus of a lot of psychological interventions, more modern interventions. We know that, unfortunately, there's lots of different ways to cope, and some of those ways are a lot less healthy than others. And it could be less healthy in that it's like emotional eating, or it could be less healthy as we're thinking about some of our older children and teens, and unfortunately engaging in some self-harm, substance abuse, socially withdrawing, and then even some aggression. And so basically what we want is to replace. So if you tell a kid to stop doing an unhealthy coping strategy without giving them a replacement behavior, it's going to be unsuccessful. And sometimes it's actually harmful because in cutting such as non-suicidal self-injury, this is a prime example that non-suicidal self-injury will put kids and teens more at risk for suicide. And it is a way to cope. And I have teens describe it as like an emotional release sometimes. And sometimes in trying to stop cutting, the suicidal ideation can get worse. And so, again, I mean, if this is going on with your child, obviously seek professional help. But it's just something to think about with all behaviors, actually, that we need to think about replacement, not stopping. And we know that that will work better. And then in terms, so this is kind of more coming from a CBT of like challenging those anxious thoughts. I find it really helpful to what I call externalize anxiety. So instead of a kid saying like, I'm really worried about this, saying the anxiety bully is telling me I'm going to fail this test, or the worry monster is telling me to not go to the sleepover, and so because then we can say, well, what do you want to say back to the worry monster? What do you want to say back to the anxiety bully? And it doesn't feel like we're shaming or attacking the kid. Another thing we see a lot with anxiety is this anxiety avoidance cycle. And so basically, and I think this is true both for anxiety and perfectionism. Basically, this fear of failure leads us to avoid the task, which makes us feel better in the short term. And in the long term, we continue to have that fear. So the example I always give kids I'm working with, I learned this from a supervisor who was from Canada. So she says, like, imagine little Johnny is going skiing for the first time, and that this is a big mountain, and he's going up the ski lift, and he gets to the top, and that's that panic peak top of that ski mountain. And he's looking down. He's like, oh no, this feels really scary. This feels like my fear is just going to go up and up. I'm going to fall. I'm going to get hurt. And then up pops a magic elevator. And you can go from the top of the mountain to the bottom and, avoid having to ski down that mountain for the first time. What are you going to do? And so a lot of kids will say, well, I'll get on that magic elevator, which is that escape or avoidance. And so in that moment, they're going to feel less anxious. However, they're still going to be really scared of skiing. Whereas if they were to go down that ski slope for the first time, the next time they go down, it's going to seem less scary. And the 50th time they go down, it's going to feel barely scary at all. And so I talk to kids a lot about what I call magic elevators. And again, it just feels a little bit softer than saying, like, what are you avoiding? Like if I say, could that be a magic elevator? And then the eventual goal is to get them to start noticing those elevators. And with school, the elevator can be not turning in work. Sometimes it's actually like sandbagging, like not trying that hard because you don't want to fail. So if I didn't try that hard and I failed, so what? Sometimes it's, and I've had this with my own kids, a stomach ache in the morning where they don't want to go is actually the magic elevator, so it can kind of pop up in all kinds of forms. And really at the end of the day, it's that avoidance cycle that can be really maladaptive, or just pure procrastination. I have this huge project. I'm worried about it. I'm not going to do it. And so the best way to overcome that avoidance cycle is exposure. And we know that gradual exposure tends to work better than what's called flooding, which is where you kind of jump to the highest thing on the hierarchy. And so if we think about anxiety thermometers or anxiety scales, You actually, let's say skiing is a 10 out of 10 anxiety. Well, let's not start with skiing. Maybe sledding is a 5 out of 10. And just even like, I don't know, walking up the hill is a 3 out of 10. So you're going to start with something actually in that 3 to 5 range that's going to be a little bit anxious. And what that's going to show is after a kid tackles that kind of moderate level of anxiety, obviously a lot of praise. Wow, you did that. Look how strong you are. You're really in control of this anxiety. And that then moving towards the harder items in the fear ladder is kind of how we approach this. The goal is honestly to get finally to habituation to where a child is used to that, whatever the stimulus is that's causing anxiety, and to where it's no longer causing an impairing level of anxiety. Again, we never want to get rid of anxiety completely, because anxiety is helpful in a lot of ways, but we just want to get to a point where people are able to manage it. And another thing we know is that genetically, some people are just wired to be more anxious, and we're actually not really going to change temperament. But again, we can manage the anxiety better. And in terms of management, these are some of my favorite coping strategies. This one's really simple and I use it a lot. So you put up your hand, you breathe in, and you breathe out. You breathe in, you breathe out. Okay. And there's all different kinds of options for deep breathing. The other one for younger kids, how old are you? 3. They're trick candles. You pretend like your fingers are birthday candles and you blow them down slowly. And there's all kinds of apps that you can do this. I find that teaching children to be more aware of their breathing can work wonders in like all different kinds of areas. And it's something that's easy to do. And then it's a mindful practice in and of itself. But you got to make it fun, and you have to make it not like, I'm going to make you take deep breaths in this moment that you're upset. It has to be like let's learn how to do this together. This is another one of my favorites. It's called grounding. You say, I actually use this one a lot for panic attacks, because I think sometimes focusing on your breathing can make people more hypervigilant of like, I can't breathe, I'm having a heart attack during that panic attack. And so 5 things you can see, like I can see my computer, I can see me, I can see my water bottle, kind of going through all the senses. And really, it brings you into the present moment. And then it also distracts your mind from whatever it is you're obsessing about. So both for anxiety and perfectionism, this can kind of just get us out of those negative thought cycles. This is an oldie but goodie. It was literally created in 1969, but my kids love it. We do it before bed. So like you pretend like you have lemons in your hand, you squeeze out all the lemons, and you pretend like you're a cat, and you stretch like the cat. So basically, it's what's called progressive muscle relaxation, where you tense up different parts of your body and relax it, but it's just in a kid-friendly way. And with older kids, you can just do more traditional progressive muscle relaxation, and there's all kinds of scripts that you can find online. But at the end of the day, it's really about having kids feel empowered to take control of their emotions rather than their emotions controlling them. And then this is just some of these common, what we call cognitive distortions. I'm always careful with that term, because I had a teen once tell me that she felt distorted when I said that she had cognitive distortions, which was exactly the opposite of what the intent was. The intent is that your brain is telling you things, but you are a different person, and I want to talk to you, and that this is actually part of like the mental health problems, not part of your personality. But I always tread lightly with that term after that happened. So there's, again, with perfectionism, it's really black and white, like either I won or I failed, right? Either it's perfect or it's terrible. Catastrophizing, one of my favorite made up words, is just like assuming the worst. And then a lot of perfectionism is really just should. So like, I should do that. I should have done better. I should have prepared earlier. I should have gotten 100, 97. And there's a famous psychologist that always said, stop shoulding yourself. Teens like that joke. And so basically, if I see a statement or hear a statement, a lot of shoulds, I will say, how can we have more self-compassion? How can we change that statement to be nicer? So a lot of times, instead of I should have started preparing earlier, I would have liked to, and that's a little bit softer. I mean, even just changing the wording that much, or self-compassion for it was a really busy week, or I had a cold and I wasn't feeling up to it, or whatever it is. I didn't get good sleep last night. And so the next little bit is actually pulling from again, I'm feeling old, somewhat newer research 2021. So a lot of our traditional anxiety research was really individual focused. And what we know for kids is that's not always the most effective, because kids require so much repetition. And so actually what we know is teaching parents more or less to be the kid's therapist is a lot more effective. And so this is the Yale Child Studies Center has this whole program called the SPACE program, Supportive Parenting of Anxious Childhood Emotions is what it stands for. And it's honestly like one of my favorite programs. In undergrad, I did some research on like family accommodation of anxiety. And that's where it was exciting to see some of the research. I was not with that program, I was with a different professor, but it was exciting to see some of that research actually turned into a treatment manual. And so basically with what's called family accommodation, it's a kid or parent or anyone in the family system experiences anxiety, and then the family system changes because of that anxiety, but the ways in which it changes actually works to maintain those anxiety symptoms rather than help that individual learn how to cope with it better. And so this can come in lots of different forms. Some of it is actually protecting the kid. And so an example of this is, sometimes it's like as simple as like repeated reassurance, like a kid over and over again asking the same question, like thunderstorms. See a lot of specific phobias of thunderstorms in like the 8 to 10 range. So thunderstorm comes up, hear the rain. Is the lightning going to strike me? Is a tree going to fall on my house? Throughout the whole thunderstorm, checking the weather app. Is the radar getting worse in my area? All those questions are actually what I would call reassurance seeking. And a parent thinks they're being nice and calm or nice and reassuring or doing the right thing by saying, no, you're not going to be struck by lightning. No, a tree's not going to fall. A tree has never fallen in this neighborhood. I don't know. So like all different statements of reassurance. And in the short term, just like that anxiety avoidance cycle, in the short term, the kid's going to feel calmer. In the long term, they're not going to learn how to self-regulate their fear of that storm. And it can actually make the phobia worse. And so that's kind of how that can actually turn out to be unhelpful. And then the other side of that is more of like the demanding cycle of storms coming, just get over it, you're fine. And so that can be really invalidating when a kid's feeling anxious to say like, you're fine, because no, they're feeling anxious and their feelings are valid. And that can make kids really mad. I've seen kids really have some outburst after a statement like that. So what do you do? So as a parent, it's actually really important to have supportive statements which show acceptance, which is, I see that you're anxious. I hear that you're anxious, and it's okay to feel anxious. We all feel anxious, and confidence that the child then can take steps to overcome that anxiety. So I hear that you're anxious, and I know you can use your coping strategies to get through this thunderstorm. And those are the supportive statements that both are validating, but not necessarily what I would call co-regulating. So that's gonna support self-regulating. And again, with my work with gifted kids, they pick up on these coping skills like so quickly. I mean, and again, it's one thing to learn it, it's another thing to implement in the moment. But unlike some of the other kids I worked with, it tends to be a little bit quicker of a process. These are just examples. You have to power through. So this is showing confidence, like you can do it without accepting. So again, this can be really invalidating. So a better statement would be, it's hard, but you have the power to get through it. I will help you now, but the next time I won't. This is acceptance of like, I hear you're stressed, without confidence of, so a better statement might be, I know you feel like you need my help, but I believe in you. And again, like these strategies are most researched with anxiety, but kind of going back to that overlap between anxiety and perfectionism, they also can be really helpful in working with overcoming some of this perfectionism. A lot of the research specifically on perfectionism, again, is looking at self-compassion. And so I find that perfectionistic people tend to be, this is actually a domain within agreeableness, within personality, tend to be tenderhearted and tend to be really caring and tend to take on the problems of the world, but don't necessarily turn that other compassion towards themselves and tend to be self-critical. And so if you can get them out of that and say, like, what would you tell a friend? If you can tap into that compassion, then that's going to be really effective. And again, working in the medical field, lots of people go into that because they want to be helpers, and then are extremely self-critical. All right, some resources. So this is that book, Breaking Free of Child Anxiety and OCD, that's based in that SPACE program that I kind of gave a brief overview of. Some books on perfectionism, and then specifically, since we talked a little bit about suicide, there's now a mental health crisis number. It's 988. You can call or text that number. And there's also in Guilford County behavioral health urgent care that you can walk into 24/7. And it's actually recommended, you can go to an ED still, but I would recommend you go to that behavioral health urgent care rather than the ED. We don't have 24/7 psychiatric coverage in our EDs, but we do have 24/7 coverage in those behavioral health urgent care. So as long as there's not a medical problem, like if there's an ingestion or some kind of self-harm, obviously come to the ED for medical attention. But if it's ideation or just kind of more mental health crisis, go to the behavioral urgent care. And then there's this great program called the Kids Mental Health Foundation, and I have a QR code there. It used to be called On Our Sleeves. My former roommate is actually the executive director. I don't get any money for this or anything, but she's their clinical executive director, and they their whole thing is making mental health free. So they have great resources both for parents and teachers. And then my reference is, but I'll go back to this slide. So I do want to open it up for questions now. Thank you all.
Hey, thanks so much, Allie. That was really helpful. A lot of great information. If anybody does have a question, please feel free to put it in the question and answer thing. I actually have a question, if you don't mind, Allie. I am fortunate enough to have a senior in high school, and she went from her home high school to the North Carolina School of Math and Science. And my teen, who was very self-assured, suddenly became full of anxiety and had a ton of imposter syndrome. She went from believing that she could do anything to believing that she was the dumbest person in the entire room. And I really struggled. I'm not sure that I've been able to help her, and I don't know if there's any like ideas that you would have that we can teach our teens. And it may even worsen when she goes to college. I have no idea what's around the corner, but is there any tips that you could give me to help talk her through some of her imposter syndrome feelings?
Yeah, that is a great question. And imposter syndrome, it's hard. It's very pervasive. And I think some of it is kind of the classic big fish, small pond to a school like that, where it's a bigger pond. And so you don't feel as big of a fish. A lot of the research on imposter syndrome is with females and minorities, because some of it is actually internalized sexism and internalized racism. And it's interesting when and I'm pulling a little bit from like our body image research. So it's, a lot of it, and the way it's related to body image is a lot of it's about like self image and self confidence. And there's this intervention that's actually trying to prevent eating disorders in youth, where they make teens really like, it's for females, make teens really upset at like the patriarchy and expectations imposed on them, and like learning more about the history. And so the same, I feel like, could work for imposter syndrome, is just kind of trying to tease apart what is exactly making you feel like an imposter. And a lot of it is these social assumptions, and a lot of that is related to that kind of socially prescribed perfectionism. Like there's this, and I think even just getting into a school like that, like I have gotten into a school like that, and therefore I feel like an imposter in this setting, because like, who am I to have gotten into a school like this? And so I think really kind of teasing apart that, and then teasing apart the different pieces of that, can be really helpful. And then really honestly just validating that, like, yeah, this is hard, and a lot of people feel this, and people feel this throughout their careers. I was talking to a psychologist colleague. Well, he's actually a neuropsychologist, so he's board certified in neuropsychology, and he was telling me recently that he still completely feels like an imposter, and who is he to like, so I think sometimes just knowing that other people also feel this way can be really validating.
All right. I appreciate that. All right. We have one question here. It's from a mom or a parent who asked if we could talk a little bit more about self-regulation and how to do that during an aggravation state.
Yes. And that's the $1,000,000 question. It's so much easier to teach these skills when we're not upset. And what I compare it to is like, um, when you're expecting a baby, you go to childbirth classes to prepare for the labor, trying to like teach a woman how to cope with that labor pain during labor is the wrong time. And so it's going to be really hard to teach self-regulation in that moment. But what you can do is model it. So I would suggest in that moment, because what you don't want to do is fall into what's called a family escalation trap, where you're trying, a lot of times it's really well intentioned. I'm trying to teach coping skills or self-regulation in that moment of aggravation, but again, that's just the wrong time. So it's better to like, you can literally come up with like I'm going to call a family timeout, where we both step apart in advance. Again, you can't do any of this in the moment, or in the moment you can start taking deep breaths to model that. And a lot of times, like with my own kids, I'll like validate, like, I see that you're really angry. Like, I'm going to take some deep breaths and we can come back and talk. But yeah, so it's more about once they're then calm after that aggravation, then you can talk more about self-regulating. And my kids are younger, but they're very visual and concrete. So they actually made these like little jars with this glitter, and they shake them up, and then they watch the glitter settle. And my 5-year-old in particular, that's like her favorite strategy. And she like now is kind of overly attached to this little jar, and she takes it with her to like when we go visit my in-laws. She's like, I need that with me. So she'll get in a fight with her brother, and then she'll run and get her coping jar. So, I think it's more about like, do we have a coping box? Do we have a plan for when those aggravations come up? But unfortunately, when we're in the moment, the best thing we can do is just kind of step back, do less. Yes.
Excellent. All right. And I think that's everybody's questions. Is there anybody else that has a question that we would like to ask Allie while she's here with us live? All right, we do have another question. Do you have any advice for helping gifted students manage anxiety and perfectionism related to testing? That's a big one. For instance, EOGs. Also, for relieving pressure to constantly perform at the highest level or top of the class.
Yeah. So I those are kind of two separate but related questions. So let's start with the that has to be the highest, has to be hundreds. Um, I would actually talk about values. I would say, like, what is your value here? Because a lot of times it's not actually a value. It's what I refer to as like pseudo values. I'm like, I don't actually value hundreds, but like I feel this pressure and like where is that coming from? So again, I would kind of explore that a little bit with them because I think that's probably leading to the test anxiety. Because again, actually we see gifted kids show less test anxiety because they are pretty confident they're going to do well. It's how do they define well? If they define well perfect, I think that's a lot of where this is coming from. And then again, before test, it's really just relaxation. Can we do some deep breathing? Can we have a game plan? Can we do visualizing how the test is going to go? Is the best way to overcome like the specific state test anxiety. And then my other question for whoever this parent is, most kids feel anxious for a test. Is there impairment? So sometimes kids feel so anxious that they can't even focus, or they're having a panic attack, or they're having trouble even like staying seated during the test. So if there's not impairment, it's more just, okay, let's talk about those symptoms in your body, feel the anxiety and sit with it. But if there's impairment, that's when I would intervene and even potentially sometimes it raises the level of like a specific phobia of test, and I would maybe get signed up for some exposure therapy to get through some of that.
Perfect. That's good. Another person asked a question. Could you discuss when and under what circumstances medication is appropriate for treating anxiety? That's a great question.
It is a great question. It's actually different. So for depression, we don't actually suggest antidepressants until 12 or 13 as more of like a first line depression. But for anxiety, what we know is actually starting at 8. For those with anxiety disorders, a combined medication and therapy tends to be most effective. And so if really it kind of comes down to, is there distress to the point that there's impairment again? So like, is the anxiety really keeping it so it's a all out fight to get that kid to school? It depends on what the area is, but like, or is the anxiety having them avoid different situations? And what I have found is there are certain kids that qualify for anxiety disorder that I am able to effectively engage in therapy. And again, exposure is our best treatment of anxiety. And there's other kids who I will start therapy, and there's such resistance even to the lowest level of exposures. And that's when and I'm a psychologist, not a psychiatrist, I will refer to psychiatry and say, let's maybe go ahead and get started on something. So I view it as a way to kind of just slightly bring down our general level of anxiety so that the therapy can be more effective.
That's interesting. That's the first I've learned about an age that they kind of try to wait until. Does that have anything to do with hormones?
That's a great question. I actually don't know off the top of my head. I did my clinical internship at Duke, and they did research on the coping cat, which is a CBT intervention for anxiety, and that was one of the biggest studies that showed that combined CBT and medication is most effective. So yeah, I don't know if it's sometimes it's literally just like what ages have been studied. So I don't know if it's just where we are in the research or if it is more hormonal with depression. And I also think anxiety tends to be more severe. I don't see a ton of really severe major depression early on. Sometimes I will, but not as much.
Thank heavens, huh?
Yeah.
We have a question from a parent. Is it a regulation issue if they have big highs and lows and not a lot of in between?
Could be. That's a hard one to answer. And I have a lot of questions about an age for that one. Teens are going to be moody, up and down. And the whole high highs, low lows could be a lot of things. Sometimes it is just temperamentally, kids are more what we call reactive to their environment, and they feel things more strongly, and that's not necessarily maladaptive. Sometimes, it could be a million things. Sometimes it's trauma, sometimes it's poor distress tolerance, sometimes it's, it could be more of a mood disorder, or it could be more of there's different disorders where and you didn't say irritability, but I always think of irritability when I hear that. So sometimes if there's persistent irritability, that could, so I think that is a hard question to answer without more information. So just depends, I think would be my answer. Yeah.
Yeah. She said that her child is 11.
Yeah, I think likely without other information, that is probably somewhat developmentally appropriate. I think as we get into those preteen, teen years, we start to see some more extreme emotionality. But again, if there's any impairment, talk to somebody about it. And it's never hurts. It honestly never hurts to go in to the pediatrician just for a checkup. Like a month ago, I went to talk to the legislature. We're trying to advocate for a mental health well child check. So in addition to having a well child physical health check, there'd be a 60-minute check covered by all insurances in your primary care office for 60 minutes for all kids. So other states have done this. This has become more universal. And I think if we were to do this, we would both prevent mental health difficulties and catch it earlier on. We know that the age between onset of a mental health diagnosis and treatment is about 14 years, unfortunately. So people go untreated for a really long time. I know that wasn't the question, but get screened if you have doubt.
Yeah, still a good thing to hear. Another question, are children with ADHD at higher risk for anxiety?
Complicated question. There is some overlap. I don't want to misquote the statistic off the top of my head. About 30%, I want to say, like comorbidity between anxiety and ADHD. When we throw giftedness into the mix, it gets really complicated. So a lot of the symptoms of ADHD overlap with giftedness. Again, like that really. So one of the things ADHD they'll talk about is like hyperfocus, where you get really interested in something and you can't even hear anything in the background going on. So my 8-year-old is reading the Harry Potter series right now, and when he's reading Harry Potter, like he literally doesn't hear anything else going on. So that's like that hyperfocus. But again, that can be really good for learning, but can be maladaptive in like task switching. And so when we look at symptoms, then like some of the restlessness, that could be anxiety of giftedness, that could be anxiety, that could be a symptom of giftedness, a symptom of ADHD, or a symptom of anxiety. And what we see with ADHD in the gifted population is that they have similar rates as the general population, which is a little between 5 and 10% is what the estimates are, but actually gifted kids get overdiagnosed with ADHD a lot of times. And a lot of it comes down to misinterpreting symptoms of giftedness or inappropriately accommodating. So for instance, if I have a kid that's too young for gifted services, but are showing like the signs of giftedness during a psych evaluation, a lot of times I'll say like, let's wait until they get into an AIG program and see how it goes, and then reassess for ADHD and see where we are. So yeah, I think there's a lot of overlap kind of with those three things in general.
Yeah. All right, if there are any more questions, now's the time. And if there isn't any more questions, I want to personally thank you, Ali, for your expertise. Thank you for what you do every day. It's really important, and we all benefit from having a healthier from the mental health perspective society that we're in. So thank you so much for what you do. Parents, thank you so much for joining us tonight. If you have any other, there's just a whole lot of thank yous, Ali. So I'm not the only one that has appreciated you tonight. If anything comes up and you have any questions, just send them to me. And we'll see if we can't get anything answered. And again, thank you all. Thank you, Allie. I appreciate you. And thank you, all of my help from Guilford Gifted to make sure that tonight ran well. All right. And this is going, it was recorded and we will send it to everyone. So I know plenty of people weren't able to come. So we're going to send it out. And once again, thank you. And you all have a good night.